Welcome to the third and final lecture in the Navigating Paediatric Palliative Care e-learning series, a guide to self-care for allied health professionals working with children at end of life. This lecture will briefly examine stress, burnout, and the importance of self-care strategies, and self-care planning. The challenges of working with patients who are approaching death and their families may be rewarding, both professionally and personally, but can also be associated with stress for clinicians. This is particularly the case when working with dying children. As children with life-limiting conditions are often under the care of health professionals for many years, the end-of-life phase and the death of a child can be very distressing for all involved. Additionally, the relative infrequency with which death occurs in childhood has significant implications for those professionals caring for this group of children. Healthcare professionals may feel a sense of failure, inadequacy, guilt, or helplessness. They may also have become very attached to the child and family and experience their own grief. These responses are normal, but in the absence of adequate self-awareness and support, healthcare professionals may, over time, become burnt out. Burnout is described in the literature as the progressive loss of idealism, energy, and purpose experienced by people in the helping professions as a result of the conditions of their work, and occurs when the stresses exceed the person's ability to cope. Burnout can cause excessive cynicism, a loss of interest in work, fatigue, difficulty concentrating, mental health issues, insomnia, irritability, damaged interpersonal relationships, and substance abuse. Whilst having adverse personal implications for healthcare workers, the professional ramifications can also be significant. Clinical decision-making can suffer, resulting in an increase in errors and, ultimately, compromised patient care. When working with families, clinicians suffering from burnout may avoid families or blame them for difficult situations, be unable to help them define treatment goals and make optimal decisions, or experience physical signs of stress when seeing families. Given the need for health professionals to present as a calm, supportive presence in paediatric palliative care settings, this can further compound familial stress, anxiety, and grief at an already challenging time. Accordingly, it is crucial that the risk of burnout is actively managed through engagement in appropriate self-care activities. Self-care refers to a group of activities performed by an individual to promote and maintain personal well-being throughout life. Self-care plays an important role in helping palliative care professionals cope with frequent exposure to death and dying to mitigate the risks of burnout, moral distress, and compassion fatigue for their well-being. Self-care is not only necessary for the maintenance of the health professional's well-being, but it also impacts the quality of care provided to patients. Recent studies examining the effectiveness of different self-care strategies in reducing burnout and compassion fatigue have concluded that the level of evidence to guide the development of specific programs does remain fairly low. They highlight that it is the responsibility of the individual health professional and their management team to determine what methods of self-care are effective for them, to document these, and to ensure that they are engaging in these activities regularly and not just in times of crisis. Some strategies for self-care, as identified in the literature, include regular supervision and access to professional development, particularly in areas where long-term relationships with patients and families are developed or where clinicians lack knowledge or skills, regular team meetings to reduce internal conflict, informal peer support, counselling, familial support, regular exercise, healthy eating, developing good sleeping patterns, engagement in hobbies and special interest activities, and relaxation, such as massage, meditation, and mindfulness. Self-care plans are a means of formally documenting an individual's strategies for self-care, as well as the frequency with which these activities will be undertaken. Sections of the self-care plan may relate to documentation of self-care strategies across professional, psychological, emotional, spiritual, physical, and relationship domains, or similar, like in the example attached at the conclusion of this module. Once the plan has been developed, ideally with one key activity in each category, it must be kept visible, adhered to, and reviewed regularly. Here, it is important to identify and address potential barriers, or, if this isn't possible, to readjust the plan to reflect what is realistically attainable. Self-care plans can be written, drawn, or internalized. They can be developed in the workplace as part of formal supervision, in partial consultation with management teams, or entirely independently of the workplace. What's most important is that a plan is made and stuck to as much as possible in order to prevent burnout and maximise the holistic health and well-being of healthcare professionals and, in turn, patients.